what we need to do is train rate of force development as well as training maximal strength. And so we need to develop, sorry about this slide, it's a little wordy. We need to develop rapid force generation. We need to improve our explosive force capabilities. And what we know is that conventional resistance training is not very good for training rate of force development. There's a bunch of evidence out there that using conventional isoinertial resistance training only improves maximal strength. It does not improve rate of force development. And so we can't just do traditional strength training. We also need to consider power, high velocity strength. So the hamstrings are used during sprinting, jumping, landing, explosive contractions, very, very short. We know that the speed of contraction during sprinting is very quick. So we have the hip is flexing at 700 degrees per second. It's the knees flexing at 100 degrees per second. And so we're having to produce force at a very high rate. And this means that we're operating on a different part of the force velocity curve. And so we need to be considering high velocity strength, rate of force development, as well as just isometric or concentric strength. So essentially adopt a holistic approach to hamstring reconditioning. Think about isolated and functional strength, maximal strength, rate of force development, high speed, and power. We also need to include this amongst some corrective core training as well. So there is a bunch of evidence to support this. We do know that we need to use functional strength training, in that if you train a muscle and you only improve its isolated strength, then it doesn't necessarily lead to improvements in functional strength. So there's a lot of work around addressing glute recruitment, addressing glute strength, hamstring strength, quad strength. We can't just train the muscle in an isolated situation. It doesn't always transfer. And there's some evidence with patellofemoral pain, again, hamstrings, ACLs. We know that if you're weak in functional tasks, it can have an impact on your hamstring recruitment. So essentially, you need to be improving dynamic joint stabilization as well. So if you've got a strong hamstring and you go into a functional task, then that hamstring may then need to support pelvic stabilization, dynamic stability of the knee joint. And so it's the number of tasks it's having to perform overwhelms it, and its force expression decreases. And so essentially, training planning considerations, there's quite a few. We need to consider the intensity of action, the volume of training, the contraction types, so concentric, isometric, and eccentric, the length we're training at, whether it's hip versus knee dominant, what's the level of functionality, what's the velocity, and what's the explosivity. So if we're training for rate of force development, we need explosive contractions. And these are the key considerations that we need to do when designing a program. And most of these are basically strength and conditioning considerations, but we need to be able to then apply it to the injured athlete.